every came here refugee camp. Everybody live the jungle. No go to hospital. No city hospital. No speak English. You live the mountain.
For recent refugees and immigrants like Ajee and his family, dealing with medications and pharmacies presents significant challenges. Among these challenges are language barriers, cultural barriers, time considerations, and building trust with new institutions and professionals. Many pharmacies are faced with finding solutions to these challenges. Hyatt Pharmacy in the Milwaukee area has a great deal of experience with these populations and shared some useful tips with other pharmacists.
Our goal as pharmacists is to explain to you how to take the medicine. We have to focus on this goal. In order for us to do that, we have to simplify the medication to you. If you're speaking a different language, we have to focus on the main things, like how to take the medicine, the main side effect, if there is a main side effect that I need to tell you about, how many days, number of times through the day, and of course, because of the language barrier, the simpler is always going to be the better.
Hyatt Pharmacy hires staff who speak the same languages as the patients in their community. Where this is impossible, using an interpreter or language line can be a solution. There are also software solutions that can provide written instruction sheets in various languages. And the show and tell technique is also useful for those who don't speak English as their first language.
When we do counseling at Hyatt, we use the show and tell technique, in which before I hand you the medicine, my conversation always starts with me opening the bottles and the devices you're getting and explaining to you what it is, what is this medicine, how it's used. So we open the package in front of the patient, we show them how to prime it, how to utilize it, how to clean it, and then we ask them, do you have a question about your medication? Now they can say no. If I ask them right away, do you have a question about your medication, and I'm giving them 10 medications, they're going to feel that I'm trying to tell them, please don't ask me a question, I have many things to do, and the patient says, no, I don't have a question. But we show, we tell, and then we ask the question. It's very important to find how did the patient communicate with the doctor. If we find this out, I mean, this is going to solve the problem, because this patient went to the doctor utilizing some kind of translation service or someone in the office who speaks the language. If we find this out, we're going to be able to communicate with the patient. For example, we had a patient who speaks Somalis, and I didn't have anyone who speaks the language on the staff. So I called the doctor's office and I asked them if they have someone on staff who speaks the language, and I found someone in the front office who speaks the language. I had this employee speak to the patient and explain to the patient the message that I wanted to convey. So many times the refugees and immigrants, they are reluctant to ask questions about the medications. So the pharmacist has to be proactive and giving the information beforehand. Some of the patients would come in and they would say, okay, I need a medicine for my flu, or like an antibiotic. They just describe to you that they need an antibiotic, even through the translator, and then you would explain to them back that in order for you to get the medicine like this, you have to go see a doctor or doctor's office. Then you try to find, okay, which clinic can they go to, maybe the clinic that speaks their language. There is also another issue that can happen, is that they come to the doctor with generics that they were getting back home. They're not approved here in the United States. Then sometimes the doctor would utilize a pharmacist, okay, what's the similar family to this medication here? So it's kind of communicating with the physician or the practitioner and the patient. The triage of care is very important to really help the refugee. I would say that when the patient comes in and deals with a pharmacist, they trust the pharmacist and what they tell them. But if I am, as a pharmacist, feeling that the patient, for instance, is a female who would be more embarrassed to talk to me about some, let's say, vaginal cream that she's getting, I try to train my female employees and technicians to tell them how these devices are used. It's gonna happen that you find a way to deliver the message as long as you allocate the time for the patient to get the message. But if I am not allocating the time for my patients in general to give them the proper counseling, I'm not gonna allocate the time for someone who speaks a different language. That's very important. It's my duty not to give you a medicine, but to make sure that you are taking it properly. Properly is like something that gives us responsibility to talk to you about what you take. No matter how busy you are, you have to be able to dispense the medicine properly. But if you just dispense it, it doesn't work. There are national statistics that say that if a patient is seeing a doctor 5 times a year, the patient is seeing the pharmacist or talking to the pharmacist 33 times a year. So 33 times the patient is interacting with the pharmacist. There is lots of messages a pharmacist can convey. There is trust that's built through month to month, day to day, week to week. I always look at our job as we're treating our family members, a brother, a sister, a mother, a father, a son, a daughter. If we believe that this is my sister or my brother or a family member coming to me, I'm gonna be giving them the maximum that I can provide. So I think looking at the person as a whole person, that this being like compassionate to the patient, it's just they would feel this connection with you, they would trust you, they would come back to you, and they would ask you more questions, and maybe they just ask you some life questions, even if you don't speak the language, but they think that you are the one in the healthcare community who made the extra effort to try to communicate with them. So I think that's important to bring to the table as well.